I recently reviewed an article for a journal that has been published now looking at the effect of an upper blepharoplasty or upper eyelid procedure on wrinkles. And what was interesting, they looked at about 46 Persian women who underwent an upper blepharoplasty or skin removal from the upper eyelids. They measured their wrinkles before the procedure and 6 months after the procedure, and they found a dramatic reduction in wrinkles even with no Botox use. So that was a very remarkable thing, and they found it both on a subjective evaluation by the patients themselves as well as an objective view from the doctors who were looking at them. The reason this is so powerful is that a lot of people struggle with Botox because they're constantly, the wrinkles don't go away because they're constantly lifting their eyelids up. And once the Botox has been able to treat the wrinkle, once the eyelid procedure stops your bad habit of lifting, you may not need as much Botox over time. In fact, I had a lady that has had a friend of mine actually, in her mid-30s only, or late 30s, that had a very high forehead, a ton of wrinkles. I constantly tried to fix the wrinkles, and then I had even a harder thing, was that her eyelid skin was so low that I couldn't put the right amount in there. Every time I put a more of it, it got heavy, and I didn't put enough in there, it didn't last because she had a bad habit of lifting her eyes up to try to hold them up. Once I did her blepharoplasty, the Botox looks so much better. It lasts longer. She needs less of it. And so that's the powerful thing, is people don't think that an upper blepharoplasty or upper eyelid surgery is simply just for, people just think that's just to make their eyelids look better, but they don't think it's going to actually hopefully reduce their wrinkles. And in some cases, it really can, as mentioned before.